Hey guys, Dr. DeBeer here with Axon Integrative Health, here to talk about dysautonomia, what that means to you, what that means as a whole, some of these symptoms that might be involved in that, other complications and cofactors that could be part of this as well, along with any treatments and support that you could be giving yourself from at home. Dysautonomia as a whole is kind of an umbrella term for anything that's dysfunctional in the autonomic nervous system. So in this autonomic nervous system is quite robust. So as we see down here in this corner, it spans pretty much the entire body, all the way from your lacrimal glands and how our eyes tear to salivation, how expanded our lungs can get, or how dilated or constricted some of our alveolar or our little lung sacs can be. Heart rate, blood pressure, cardiac output as a whole is all driven by the vagus nerve, which is a main contributor of the autonomic nervous system. Your liver, your spleen, your gallbladder, your pancreas, your stomach, your kidneys, all of this is innervated by your mesenteric nerves, and these nerves down into the gut, these are also vagal innervated. These are also sympathetic, parasympathetic, all the way down into large intestine, small intestine, bladder, how we digest food, how we accept nutrients into our bodies, how we modulate inflammation from the outside in, is all really housed by the autonomic nervous system. Mounting immune responses, things like that, is really the autonomics control these systems, if you will. All the way down into reproductive organs, external genitalia, just to show that all the way from dry eyes to GI issues, fatigue, immune system dysfunctions, hormonal issues and imbalances, all the way to just generalized nervous system dysregulation, can all be linked back into a dysfunctional autonomic nervous system. It's a sympathetic nervous system, so if you've heard of fight or flight, that's what the sympathetic nervous system is. It is part of the autonomics. And then the parasympathetic, which is your calming or your rest and digest, as it's commonly referred to. On top of that, you have your ENS, or your enteric nervous system. Some individuals like to delineate or make a difference to the nervous system that's contained within our gut and send signals back up to the brain in just communication land. So those are our two sets of nervous systems within the autonomic nervous system. So if you're familiar with being stuck in fight or flight, that's a very common symptom or issue with a dysfunctional autonomic nervous system. Now, this could be part of it. This could just be your main contributing factor. Just years of nervous system dysregulation has caused into this. Stress, anxiety, poor nutrients, low exercise, things like that, chronically can build up and tax our nervous system into causing these dysfunctions. We could also be looking at the other way around. Maybe we had a head injury. Maybe we have known hormonal disbalances or imbalances that are leading into further things or spreading its dysfunction now into the autonomic nervous system, which is then going to further dysregulate other systemic things on maybe how you regulate blood sugar, how your hormones are being produced, and that hormone dysfunction is feeding back into the dysautonomia, which is feeding back into the hormone dysregulation. So all of these things are very linked, right? If you think of something that is done automatically in the body, you can assume that it is controlled by the autonomic nervous system. If we're not consciously thinking about it, it's probably controlled automatically by the autonomics. Overall, a good support system for this, and if you're feeling this even lightheadedness or dizziness, blurry vision, all of these are also into this dysautonomia side of things and how we divert blood throughout the body. If we know POTS is a very common dysautonomia diagnosis. We can also have other things outside of just POTS, things that aren't necessarily correlated with autonomics, like GI dysfunctions or IBS, ulcerative colitis, leaky gut. All of these could be linked back into a dysautonomic state. So making sure that we're treating the nervous system and regulating it as a whole is going to be extremely beneficial to you and what you have going on. To help with your parasympathetics, doing things slower. Just do them slower in your day. Do your dishes slower, talk a little slower, not in the point that people think there's something like off with you, but just talk a little slower, brush your teeth a little slower, get ready in the mornings, calm down before bed. Another big one is eating. Very easy to activate your parasympathetics if we eat. And by doing so, we need to be intentfully eating, not eating on the go like most of us do, because we're not able to trigger that parasympathetics because our mind's activating, we're staying in this fight or flight, we're just also consuming at the same time, which doesn't really help our system at all. Chew your food slowly, eat a little slower. These are going to have fantastic implications into your nervous system, into helping to regulate it, helping to get you your brain activation and your mental clarity to where you want it to be. The fuel to your brain and into your nervous system is such a crucial aspect of the healing process. We need good protein intakes, we need healthy fats, we need complex carbohydrates, we need to be able to stay away from simple sugars, from things like gluten, things like dairy that are highly inflammatory, especially just in this moment, right? Once we accomplish the goals that we would like, we can return to a semi-open, if you will, diet or nutrient state. I like to preach or coach 80-20 principle, where 80% of the time we're eating for the fuel and for your health and for your brain health. 20% of the time we're indulging. I don't care what you eat. Just have a good time. That seems to be the best long-term solution for regulating proper nutrient intake, diet, and making sure that we limit unneeded or unwanted inflammation in the body. Overall, inflammation is not a bad thing, especially if we roll our ankle or we get poked by something or we slice a finger. All of that is going to attract acute inflammation. That's actually really good for our body and stimulates healing. When we have these chronic inflammation issues, it creates further issues down the line. So nutrients are number one to really make sure that our body's getting everything that it needs to rebuild itself and to heal, as well as to optimize, perform for future days. Oxygenation and breathing can be our easiest and most effective way at regulating our nervous system. It's 100% free. You can breathe in line at the grocery store. You can do intentional breathing at the stoplight or at a stop sign while driving your car. Just taking a few deep breaths in and out can really help calm our nervous system in a particular situation, or just in a day-to-day basis to stay regulated. My top 3 breath works are a physiological sigh, so 3 inhales, a hold, and a big exhale. So can repeat this 3 to 5 times. You see how fast it is, so you can do this pretty much anywhere. It's fantastic at regulating the nervous system in the moment. If you have a few moments, 3 to 5 minutes, let's say, sit down, do some box breathing, pick a good number that's comfortable for you, anywhere from 3 seconds to 7 seconds. You can even start at 3 and work your way up to 7. But over these 3 to 5 minutes, take inhales, holds, exhale, holds, all for equal amounts of time. You can also combine a Ujjayi breath or a hum exhale at the same time that you're doing these box breaths. So when you go to exhale, you can trying to breathe out of your mouth but keeping your mouth closed. You'll feel that air circulate back and come out of your nose. It's a fantastic way to stimulate our vagus nerve and to help calm this autonomic nervous system down and regulate itself. Exercise, this is needed by everybody. If you're getting dizzy or headaches or blurry vision or fatigue, that's okay. Exercise to your capacity. If you're lightheaded, you have a headache, and your exercise and those numbers or that intensity of pain or discomfort increases, stop. Pause for a second, maybe try to continue, or just call it quits for the day. Try again tomorrow, right? If you don't have those things, push through it. With the brain, you don't really want to push through pain. So if you do start to exercise just a little bit, it's going to continually build and help your system. You might have to start really small. It might feel so insignificant Don't worry about that just yet. Just keep doing your stuff, keep moving forward, keep trying to challenge yourself. Over time, this will help improve blood flow to your brain. This will help improve oxygenation into all of your body, all of these nooks and crannies that need oxygenation to heal. It's also going to help, it's going to help your stress, your cortisol management. It's going to help release endorphins to manage pain and also stimulate proper regulation of the nervous system. It's also going to really help with sleep. If you're burning these calories, you're exercising, you're sweating, you're building adenosine up in the body, which is going to help you fall asleep easier later at night and stay asleep. Another thing is just targeted therapies, right? We specialize in dysautonomia care, post-concussion, things like that, other comorbid issues. Everything that we've already talked about, GI issues, blurry vision, dizziness, headaches, things like that, lightheadedness, all of that is right up our alley. So feel free to reach out to us and we can certainly set a plan in place, whether that's at home therapies and exercises to be doing specifically for you and what you have going on, or therapies and modalities that we have access to here in the clinic, support with brain rehab, body rehab, mental health, neuropsychiatric inputs, or neuropsychological inputs. All of these things targeted within the clinic can really help your nervous system regulate and have much deeper implications into your health and improvement, performance, optimization, vitality, making sure that you're feeling the best you can. So try those things out at home first. If you're having success with those, great. If you want a little extra help, we would be happy to help you and kind of get you back to the life that you deserve, without any fear or pain or neurological dysfunctions getting in your way. If you're dealing with stress or stuck in this fight or flight, or chronic pain, or irritable bowel syndrome, ulcerative colitis, constipation, cortisol issues, dysregulations, all the way to sleep issues, brain fog, dizziness, lightheadedness. All of these things could be potentials in dysfunctional autonomic nervous systems. Making sure, ruling out that you don't have dysautonomia, or at least supporting your autonomic nervous system through that journey, could do you wonders in your treatment plan, in your treatment journey, in your health journey. So employ some of these things and see how that affects your health, and have a great rest of your day.